Bleeding gums are not just a sign that you need to brush more gently and pretend it's not happening until it goes away. They can also signal an increased risk of heart disease. There are several ways that periodontal disease can increase cardiovascular risk. The first is bacteria. In gum disease, deep pockets can form around the teeth. These pockets become inflamed and can bleed. This can allow oral bacteria to enter the bloodstream. A small amount of bacteria entering the blood is not unusual, but repeated exposure from chronically inflamed gums may increase inflammation across the body, which brings us to the second way, inflammation. Periodontal disease is associated with higher levels of inflammatory markers such as CRP, interleukins, and TNF. These markers are also linked with cardiovascular disease. Atherosclerosis is not simply a plumbing problem where cholesterol blocks a pipe. It's an inflammatory process within the artery wall. That is why long-term gum inflammation is relevant to heart attack and stroke risk. Third, blood vessel function. Studies have linked periodontal disease with poorer endothelial function. The endothelium is the inner lining of the blood vessels. It has an important role in blood vessel flexibility, blood flow, and clotting. Impaired endothelial function is an early sign of vascular disease. The fourth is clotting. Periodontal disease has also been linked with increased platelet activation. Platelets are essential for normal clotting. Without them, paper cut becomes much more dramatic than anyone needs. But increased platelet activation can contribute to thrombosis, particularly in people with existing vascular disease. Now, an important caveat, this does not mean that gum disease is imminently going to cause a heart attack, but there is an undoubted link between gum inflammation and cardiovascular disease. So if your gums bleed regularly, do not just ignore it. See your dentist or hygienist so that you never need to see a cardiologist.